City of Jessup or Amanda, can you guys hear us all right?
Yep, I can hear you just fine.
Beautiful, thanks.
Ready.
All right, good morning, everyone, to the Blackhawk County Stakeholder Review for the proposed non-public water well supply wells ordinance. My name is Jared Parmenter. I'm the Environmental Health Program Manager for Blackhawk County, and we've been working on this for some time. So thank you all for taking the opportunity to probably review the ordinances and then join us for today's meeting. I think what we'll do real quick is go around the horn internal here and let you know who from our staff is present. We basically have the better part of half of our environmental staff on this call this morning. And then we'd like each of you who are on here to give just an introduction as to who you are and maybe who you're with, if you are representing an organization. And then we'll get into this review itself. Just as another added note, today this is going to be recorded. So we'll maintain the recording here at Blackhawk County and be able to provide it to anyone who should ask for it, you know, be they other stakeholders in the community or be they like the Board of Health or Board of Supervisors who couldn't attend today. As I said, my name is Jared Parmenter. Off to my left, we have Eric Heinen. Eric, if you want to just go ahead and go around the horn.
Eric Heinen. I'm an environmental health officer with the Blackhawk County Health Department.
I'm Alex Ritz. I'm the Healthy Homes Program Coordinator with the Blackhawk County Health Department.
Kelly Amador, Environmental Health Officer, Blackhawk County Health Department.
Laura Snell, Environmental Health Department intern.
Jenna Deepas, Environmental Health Supervisor.
Okay, very good. Now we'll transition over to you guys. Ryan, if you'd like to introduce yourself.
Yep, Ryan Butke with Shovel Well Company in Fredericksburg, Iowa. We're a water well drilling company and also do some submersible pumps down there. Pump contractor too.
Very good, thank you. Amanda. And then City of Jessup.
Yep, this is Mike Feckheather, Public Works Director for the City of Jessup.
Wonderful, welcome, Mike. Thanks for coming on today. All right, Amanda.
Yeah, I can check with her. She might not be at her desk right now. So
Oh, no worries, man. If you guys are from the same, you're both from Shawver, right? So
yep, correct.
Okay, no worries. I think we'll just maybe jump in. Looks like we got a chat from her. Oh, she can hear us now. Good. All right, we're going to go ahead and get into this. As I said, this is the stakeholders review for the of the proposed non-public water supply wells ordinance for Blackhawk County Public Health dated March 6th of 2023. And of course, now
It's not working.
yeah, nothing.
Ah.
I don't know how it goes.
Yeah.
I will drive that. It's all seized up. I guess we're having some issues here. Hold on.
There we
go.
All right, quick overview for the agenda this morning. We're going to start with the background, what prompted the ordinance update and the revisions, the process of review, which will include the documents we reviewed and why they were pertinent to the process, overview of the proposed ordinance, the changes we made and why we made them, next steps, what happens after today's meetings, and lastly, we'll take recommendations and questions that you may have and give a timeline for any further recommendations or questions.
Very good. Thanks, Jenna. So this all began a few years ago in March of 2020. So I guess 3 years ago, probably, well, definitely this month, but nearly to the date. We had a Board of Health work group. At that time, we did a complete and comprehensive review of existing regulations in Blackhawk County. We had key regulatory staff from our offices along with the Board of Health, and we reviewed all of the ordinance for content and prioritization. At the time, I want to say there was 10 or 11 regulations or ordinances that we reviewed. And then what we effectively did was prioritizing each of the ordinances for review. So the outcome, basically, there was a recommendation of a 3-year cycle of review for each public health ordinance. So we broke them out, prioritized them, and then put them into a cycle of 3 years for review. This is something that really hadn't existed before then. You'll know, like with this ordinance, that the last time this puppy was reviewed was in 1999. We had one that was a bit worse not too long ago. I think it was what, 88 for the childhood lead poisoning ordinance. So a couple of these documents absolutely needed significant review. And this was obviously one of them. For the 3-year cycle review, it was implemented by Blackhawk County, and we had begun to push forward with it. And then, of course, COVID hit, and it was a bit of a stumble for us. We had about 18 months to 2 years where our efforts were definitely focused elsewhere. And so now we're back on track with the ordinance review process. Also, what's going to come out of this is an updated DNR 28E agreement. 28E agreements are effectively contracts between Blackhawk County Public Health and other larger state organizations, be it the DNR, be it the Iowa Department of Public Health, which is now Health and Human Services, or the Department of Inspections and Appeals for things like our food inspections. This agreement between the DNR and Blackhawk County essentially deputizes us to do a number of things under that agreement, right? So for this one in particular, it allows us to do well permitting and well inspections on behalf of the DNR. So what does the DNR require? The DNR requires that the county it requires us to certify that we've lawfully adopted private well construction and reconstruction regulations. So the enforceable regulations in this case are in accordance with the Iowa Code section 455 Bravo 0.1723, and that satisfies one of the following standards here. So either the ordinance or regulation adopt the reference chapters 38 and 49 of the Iowa Administrative Code as a whole. It forces us to adopt excuse me, those chapters in their entirety, or it allows us to update a regulation or ordinance that's consistent with and no less stringent than chapters 38 and 49 of the Iowa Administrative Code, or the ordinance and regulation grant express authority to the permitting agency to implement chapters 38 and 49 as provided by the code subsection. So we're going really with that option 3, where we're taking that existing regulation and we're making it consistent with chapters 38 and 49 and no less stringent than. All right, so as I stated earlier, this is the current water wells ordinance we have on hand is 1-99. This was adopted by Blackhawk County in the year 1999, which is the year I graduated high school, which is kind of crazy to think of. The current regulation does not reflect all of the current Iowa Administrative Code requirements for the DNR. And so an updated regulation was really needed to comply with this DNR 28E agreement.
Okay, so like Jared said, our current regulation does not meet the requirements of the Iowa Code. So when we started our process of review, we obviously started with Iowa chapters 38, 39, and 49. We also did a review of Lynn counties just to see where they were sitting in comparison with us. And obviously our old regulation, Blackhawk County Regulation 1-99. So in accordance with Blackhawk County Public Health equity stance, we did a health equity assessment. It just comes from the belief that everyone should have a fair and just opportunity to achieve health and well-being. So Blackhawk County has many residents of different nationalities, socioeconomic backgrounds, and household customs. So the health equity assessment was performed to evaluate the impact of this regulation on health equity, and it was conducted by the Blackhawk County Environmental Health staff. The assessment raised concerns regarding rural communities and the potential for lack of access to clean water. The proposed ordinance would update and enforce safer practices for the implementation of private wells. Safer practices for private wells helps ensure rural communities have access to clean water. So an overview of the proposed regulation, we really needed to update the format. So the proposed revision is written in current county regulation format. It utilizes the correct and more modern naming conventions used by the county. And it also needed to be placed in the proper chapter. So the revised regulation will be recognized under Title 8 Health and Safety's designation, specifically Chapter 8.35. So some of the content changes, we did a name change to public water supply wells. Expanded purpose and applicability. We removed a section titled general, it kind of, the contents of that section were addressed elsewhere. We did also increase the number of definitions to coincide with definitions in the Iowa Code, chapters 38 and 49. And we also included the adoption of current Black Hawk County enforcement procedures, which included updating the regulatory language for hearings, variance requests, and for filing of injunctions. The major change would be the minimum lateral distance from sources of contamination to reflect chapters 49. So this table basically encompasses the majority of the changes that were made. We see the change from the preparation of storage area for spray materials, commercials, fertilizers, chemicals that may result in groundwater contamination was moved from 100 to 150. Some of the language changed, sanitary landfills, solid waste landfills, and disposal sites. So just more robust definitions. Those distances did not change, just the language changed. Oh, go ahead and next slide. This was a new addition altogether. So this designates LPG storage tanks different from other hydrocarbon storage tanks. The distance being much shorter than from other tanks. It also added roadside ditch and road right of ways and frost pits. Okay, slide.
Okay, so the next steps here then, really what we're looking at is the revised version of the regulation 199 water wells. It was formally proposed by the Black Hawk County Board of Health in January of 2023. So what we're looking at here today, obviously, as of March 6th, we had this well ordinance public hearing for stakeholders. Notice was provided obviously in advance through a few different ways. We emailed the county stakeholders. We looked at really any of the folks we work with who are in the business of in placing wells. We looked at a publication in the Waterloo Courier, and we had Black Hawk County Public Health social media pages and our website for really providing notice and putting things out to the community. Stakeholders obviously were invited today for review and discussion. We're going to open up a public comment period after today, though. So what we'll do is we'll provide a link to this presentation. And send that out in an email to basically everyone that we had pushed out an email to beforehand, so people can take a look at this. They can get this presentation. We'll probably send out the slide pack as well. People can review that and then submit any comments, questions, or concerns that they may have by March 13th. Close of business Monday, March 13th. We're going to move forward with this, and we'll go ahead and schedule this for the Board of Health meeting at the end of March. Anyhow, so any of those revisions that we do come up with, or comments or recommendations that come out of this meeting, they're going to be considered before those final revisions being made. So we'll make any final revisions we have. I believe it's March 24th. 22nd. Thank you, Jenna. Is the Board of Health meeting this month, and we'll present at that time. Board of Health will review everything that we've discussed here. They'll take a look at any changes that were made, and then they'll vote either to rework it or to accept in full. If they accept, then things move on to the Board of Supervisors. So the final draft of this ordinance and meeting minutes of this meeting will be presented obviously to the Board of Health at the end of March. Like I said, if approved, it's going to go to the Board of Soups. After the Board of Supervisors approval, the ordinance will be adopted and it becomes enforceable. At that point, we'll publish it in its entirety. So we'll make sure that hard copies go out into the community. We'll push them out to various stakeholders. We'll email a final draft of all of that to everybody. Like I said, we'll print out copies and have those available here at the health department, probably city halls across Black Hawk County. In addition to that, we'll make sure we get it on our website for anybody to review. And yeah, it'll go out and publish, I believe, in the Courier in its entirety as well. So multiple ways of it getting out into the public and Easily able to get a copy of it. And then after that, the next step is really updating that 28E agreement with the Department of Natural Resources here in Iowa. So we'll go ahead, we'll submit that revised ordinance to the DNR, and then we'll submit that alongside an updated 28E agreement. And then, yeah, we'll solidify that relationship after that's complete. So at this time, we open it up to those of you who are on for any recommendations and questions you may have. Ryan, Amanda, Mike.
No questions from me at this time.
Thank you. Shabra, you guys have any questions today?
No questions for us right now either.
Okay, well, thank you very much. Let's see here, we did get okay, very good. Okay, so as we stated here in the presentation, we're gonna go ahead and send out a link to this. This presentation here today, we'll probably put our PowerPoint in it as well. We'll go ahead and send this out to everybody. We'll wait a week, and come March 13th, we'll take any recommendations or changes we have at that time, incorporate that into the work, and we'll move forward with it. We want to thank everybody today for hopping on. It's always good to see partners in this, in the field to show up and support this and really be taking interest. So we do thank you for that. I guess barring that, does anybody here in the room have any questions or comments? Okay. So thank you all again for being here today, and we hope to hear from you guys in the future if you have any comments or questions. Other than that, you guys have a great day.
Thanks, everyone.
Thank you.